We have adopted in our service plan this year that the implementation of these programs, which start in the current year, is the important theme for our service plan for 2011. We have looked at these programs and committed what we think are the necessary resources, diverted the necessary resources, both in terms of funds and hotel equivalent posts, into the implementation phase that we're now heading into. The focus has to be our accountabilities to the patient, our accountabilities to the communities within which these settings operate, and our accountabilities to the taxpayer who funds our health system. So, that is the accountabilities that we have, and that's what that's why we want to turn, good hospitals into great hospitals. That's why we want to improve access and cut our waiting times. That's why we want to improve quality, and that's why we need to deal with how do we really utilise resources in our system.
The reason why a number of the programs are selected, such as acute medicine, is because it relates to our trolleys, and it also is the opportunity to release resource. So some of the first programs off the block are the programs that have the greatest opportunity to release substantial resource into the system. That's one of the reasons why we selected them, so that we're not going in with impossible asks. I think really just our overall what we've got to do is we've got to improve the way we deliver care. In other words, we've got to save lives, prevent mortality and morbidity, and at the same time, we've got to do it off a lower cost base. So we actually have to save money. And that was one of the biggest challenges coming in. Could we actually come up with solutions and ways of doing things that would save money as well as save illness and prevent illness? And the answer is yes, we can. The next question is, can we do it in the short term? Because that's again what we need. It's fine. We certainly have to take on things that will actually give us a return in 5 or 10 years. That's very important. But actually, the pressure that we're under at the moment, we need to do things and start releasing things for us now, or in the next year, or start making things better in the short term. The overall principle by which we've approached these is that every single initiative that we're taking on has to have cost savings, has to improve quality, and access, and compliance is really just legislative requirements. But the primary focus is on can we come up with solutions that save money, improve quality, and remove waiting lists. We've also tried to target those that are meaningful to us clinically and will be meaningful to the public and meaningful to the political system, such as if we're going to prevent a death or a disability from stroke every day. That's something that's meaningful, that's something I'm willing to get involved in and spend time on it. We're very strong clinically, we have very well trained people in our system. And the other thing is we actually have some very good managers in our system. And that's the thing that's coming out from people who are coming from outside the system. So we do things well, we just don't do it right across the system. So we need to nationalise existing good practice, a very important component of this, and not to reinvent the wheel. So a lot of our programs are based around where we've actually got it working. And every program has had to demonstrate in terms of the validation step, where if we were to implement this, what gains are there, and what evidence are there within the Irish context of this, that this is already working. So with heart failure, we have it working in Vincent's. With COPD outreach, we have it working in Beaumont and James's and the Midlands. The programs are focusing on 2 different aspects. The first thing is the standardisation documentation, for want of a better word, which is guidelines, care pathways, patient information. And each program is producing that information. And the second thing they're focusing on is specific solutions to improve service. That's the quality, access and cost.
But we have to recognise that we're working, I think, in a society and in a health service that is under considerable strain. And this will impact on our ability to deliver the kind of goals and outcomes we seek to achieve. The system, our health service and our brand, if you like, has taken a battering over a whole series of adverse incidents and major reviews that highlighted, I think, deficiencies very often in governance and accountability and in leadership. So it's a time, I think, a difficult time, but it is a time, I think, for vision and for leadership, and I'm very heartened to be with you today, to see the kind of meeting that today represents, something that I think a number of years ago we might have dreamed about, but we didn't see this kind of partnership between senior management, between senior clinicians, nurses, doctors, patients. I think out of this kind of collaboration, I think we can see what we can achieve, and I think it will be something quite considerable. The vision is one of knowledgeable patients receiving safe and effective care from skilled professionals in appropriate environments, and most importantly, with assessed outcomes. Obviously, the programs are all about clinical leadership in partnership with management leadership. It's all about mobilising evidence to achieve the kind of outcomes we know will ensue if we achieve that. But the sustainability, the kind of change that we're describing today, requires a change in culture. And fundamental to that, I believe, will be clear structures of accountability in our health system. Everyone needs to know who's responsible at each level of delivery. We need the people in charge to be waking up and in a sweat, not just about the fact that they're over budget, or the fact that their head count is askew, but the fact that their patient safety outcomes and their clinical care outcomes are lagging behind or are not benchmarking well. That's what people need to be waking up about, and that's what this is fundamentally about. So we need to ensure that those who are responsible then for this kind of change have the authority with which to achieve